the ball to them. Thank you very much for joining us and welcome.
Hey, thanks, Vinny. Hi, everybody. My name's Eric Wisataky. I'm the Residency Program Director for the PM&R program with MedStar Health, Georgetown National Rehabilitation Hospital. I just want to say a quick hi before our chief residents take things away. Really excited for you all to have an opportunity to learn about our dynamic program with so many unique aspects in a great city in the country, such a fun place to spend 4 years of your life. And I just want to welcome any of you to reach out to me anytime if you have any questions about our program. I'll put my email in the chat box of this Zoom, and I'm happy to correspond with any of you with questions at any time. I'm going to turn things over to our outstanding chief residents, Alana Hartman and John Stratton, to talk to you more about our program. So have a good night, everyone.
Hi, everybody.
All right. Hi, everyone.
John and I just started chief residency a couple of months ago, but already getting pretty busy. We just want to start, since y'all can't come and visit necessarily, with a video, and please ignore other stuff I've opened. I don't think there's anything on here. Share audio. All right, so this is a video that we found that we think does a good job describing DC. So we just want to start with this. You guys get a little virtual tour. So as Dr. Wisataky mentioned, sorry, there we go. Our name's really long. It has a lot of work. There's Georgetown in there, and it is MedStar Health.
So this is just a picture of basically someone doing it. So the idea behind keeping this in there is that the National Rehab Hospital is actually this person, right? It's Ed Ekanoff. And the reason we like to bring that up is because the MedStar National Rehab Hospital was actually founded as a rehab hospital. It wasn't a different type of hospital or acute care or anything like that, and then transitioned into a rehab hospital. So we like to that the whole structure and the whole culture around the hospital is really centered around rehab and kind of always has been since its induction.
And then one of the other things that helps us stand out is we actually are CARV accredited, not only for stroke, brain injury, amputee, and spinal cord and pediatrics, but now we also have an accreditation for the cancer rehab program, which is huge. And it also just means we get exposure to all of this, and we get to work with specific units, specific rotations that are based just on each of these specialties.
So just a brief picture of the MedStar National Rehabilitation Network footprint, right? So most of our clinical work is done at the National Rehabilitation Hospital, which is right in Washington, D.C. And obviously you don't travel to all these places but this just gives you an idea of how expansive the MedStar National Rehabilitation Network is, right? With 52 outpatient centers kind of scattered through. So you got to have an idea of how big it is.
And just because I know this is one thing that does stand out, the furthest we really go is probably our rotation in McLean, Virginia, which without traffic isn't too bad of a drive. With traffic, it could get a little bit longer, but no more than 30, 40 minutes to get to a rotation. But the ones that you do travel, it's really worth it. So like when we go to Walter Reed from where John and I live, it takes us about 45 minutes to an hour, but it's worth it to go there every day and get to learn from Dr. Miller, who's phenomenal with EMG and teaching, and getting to see the active duty population and getting that experience with the DOD is amazing. And then here's just a picture of our leadership. You got to meet Dr. Wisataky. Dr. Maxwell is our associate program director, but he's also the head of the sports medicine fellowship. And then, sorry, Dr. Wisataky, the most important person on this is Jennifer. I'm not going to try and say her last name because I butcher it every time, but she is one of the most amazing program coordinators and really makes our program run smoothly and becomes your friend very quickly. And then I'll let John introduce Sal.
Yeah, Sal so Dr. Pinduprolu here, who asks to be called Sal or Dr. Sal, is the internal medicine program director we are now a categorical residency, and everyone does their internal medicine year at Washington Hospital Center, where Sal runs the internal medicine program. And she is absolutely amazing. I've never heard anyone say a bad thing about her. She runs a great program in the largest and highest level acuity and busiest hospital in Washington, D.C. So when you are doing your internal medicine training there, you definitely get good training, you get a lot of good exposure, and you get to work some really great teachers and a really great program. So we won't go in too much into it, but she's really great.
As a PGY too, when I was sitting in her presentation during interviews, I wish I was happy with my intern year, but I hearing her talk, I wish I got to work with her because she's really awesome and she remembers all her residents, and that's hard when she has as many as she does. But she wants to come to graduations and things like that because she really connects with the prelims, which is really amazing for a prelim program director. You want to go?
Yeah, sure. So just some kind of a highlight slide. So our trainees it's 6 residents per year. Now, like I said, we're categorical, so we have a total of 24. With fellowships, we have a ACGME Sports Medicine Fellowship. We have an ACGME Brain Injury Medicine Fellowship, a non-accredited Cancer Rehab Medicine Fellowship, and a Pediatric Rehab Medicine Fellowship. That's really, the Pediatric Medicine Fellowship is really based out of Children's National, but Children's National is actually on the same campus as National Rehab Hospital, and the inpatient pediatrics unit is physically located within National Rehabilitation Hospital. So there's a very close partnership there. So we kind of consider that our PEDS fellowship, even though technically it's not really ours. We now have an interventional spine NAS accredited fellowship. This is with Dr. Desai, who's like one of the leaders in the field of spinal interventions. So it's a newer program for him. He hasn't always had fellows, but he's like absolutely one of the best. And then we do like to always bring up the fact that we actually have a continuity clinic that is truly your continuity clinic. Every Wednesday afternoon, you have your own clinic with your patients that continue to follow you and they come to see you. This can be patients, and you can kind of tailor your clinic to how you want it. So this can be, if you're really interested in inpatient care, you can make sure that you're getting a lot of inpatients that you refer to your own clinic for, like into out visits. If you're really interested in neuro rehab, you can have a lot of neuro rehab patients come in and do a lot of Botox and spasticity management. If you're more interested in musculoskeletal medicine, you can kind of tailor your clinic to how you want it to be. But we always like to mention, these are actually your patients, so it's a little bit different.
And then we have different tracks. So the research track, we have the NIH affiliation. However, you don't have to do it at NIH. Taylor Mansfield and now Daniel White have both done some research with Dr. Desai, and that's been a really good opportunity. And really, Taylor's applying to pain, and he's doing amazing with his application process right now. And then the NIH research, we have 4 PGY3s doing that this year. And they work with Dr. Alter, who's a trained pediatric rehab doctor, but also amazing with the ultrasound. And you also get to use the most amazing ultrasound machine you'd ever think of, because NIH gets great funding. But there's a bunch of different projects you can do there. And even if you don't do research, you do a month of outpatient at NIH, so you get to meet the attendings and can do research on your own without having to be part of the track. And then it does replace some stuff in our schedule, but that's not too important right now.
Another track is the ultrasound track. So if you're much more interested in musculoskeletal medicine, you can replace some of your electives with just like ultrasound training, where basically you just get more time for self-study, more time for hands-on ultrasound training with some of our better MSK and ultrasound practitioners, and then more experience doing some like ultrasound guided injections, that sort of thing, if that's something that you really think that you're doing. Now, even if you don't want to do the ultrasound track, that's not to say that you won't get a lot of hands-on time with ultrasound. We have an entire ultrasound curriculum that we go through every year with a lot of hands-on workshops, and you will still be expected to and have the opportunity to learn how to do ultrasound, hone your ultrasound skills and work on a lot of ultrasound guided procedures. But for those people who are really passionate about it, you can do a little bit of extra time if you want to.
And then the global health track, I'm actually the first person to do that. When I started, I had mentioned to Dr. Wisataky that I was interested in global health. And instead of just telling me to find something on my own, he actually did research and was able to find that Georgetown has this global health track where initially it was started for internal medicine and pediatric residents, and they've expanded. So COVID hopefully will calm down at some point, but has kind of changed this a little bit right now. But during your PGY 4 year, you get to go spend a month elective somewhere. So the plan is Namibia. I don't know if they'll actually let international trainees in, because all their COVID cases actually came from international travelers, but one person per year can apply and do it. And the benefit of this, rather than just doing a global health program or just going away for a month and doing something, is they actually teach you how to do global health. So if it's something you're actually considering in your career, you learn some really important things and how to really be a part of the global health community.
So this is just kind of a picture of some hands-on learning things. Like I said, you do some ultrasound workshops, which is what's happening in that middle picture where we're practicing doing injections and finding a needle on a piece of meat. Of course, it's not always done on pieces of meat. We obviously also ultrasound each other. And then you can see on the left, we always spend some time doing different things with prosthetics and orthotics, trying to get a little bit of a better feel for what patients are going through when they're having to put these on, which gives you a better idea of how you're supposed to be prescribing them and what types of things you should be considering when doing so. And then all the way on the right, you can see one of our recent grads doing a practice Botox injection in one of our spasticity workshops.
And then one of the other great things is our program is really supportive of us going to conferences and doing research. And for a poster, you actually get to go to the conference, one conference a year that is fully funded. So it's a really good networking time, and you can also get to show off kind of what you're doing. And we're happy to have med students help us out. So here's when Lorraine was a med student, she did a poster with Mike Farrell. And it's just a fun experience overall.
So this is a picture, so I'm sure a lot of you are hearing a lot about physician wellness, and I'm sure it's probably important to you for good reason. MedStar Health takes physician wellness very seriously. Hopefully as rehab residents, for the students and for the other residents on the call, hopefully as rehab residents, wellness hasn't been too much of an issue for people, but regardless, MedStar takes it very seriously, and there's a very big push for physician well-being at MedStar Health. Dan Marchalik, Dr. Marchalik, who's the urology program director, is the person pictured there in the middle. He kind of heads up physician well-being. We also have a wellness champion for our hospital, and then we have resident wellness champions within the residency program. The wellness, we do a lot of events, but then more specific for like what MedStar does with their wellness initiatives include things like having a physician concierge, which can help you do things for anything from finding childcare, finding adult care, finding pet care, getting tickets to something, helping you try and get your car fixed, like any of these kinds of things that you may need assistance with, especially if you're moving into a new city. Things with professional development, like financial advice and all that kind of stuff, all kind of fall under this umbrella of these wellness initiatives that MedStar Health as a whole is trying to promote.
And on that note, with everything going on, MedStar has been working on diversity workshops and things like that to kind of address the discrepancies in healthcare and things like that. And I know a couple of the residents and attendings are trying to talk to each other and kind of figure out how we can work together to do our part to help with that conversation. And then like John said, we do quarterly wellness events, and we also kind of just hang out together for our own wellness. Like this picture, we actually are all best friends. John and I and Mike Farrell, Ben Miller, Matt Kelly all moved to the same neighborhood and literally live at each other's apartments and actually spend every day together, even though we work with each other. So it really is a great community where wellness for us is actually hanging out with each other and not running away from each other, which is nice.
Hey guys, sorry to interrupt. Just want to let you know you have 4 minutes and 30 seconds.
Oh, all right.
We'll talk faster.
Yeah, we'll speed up. So this is just a picture of some wheelchair basketball going on. So actually in this picture, that's actually one of our current attendings and one of our current residents. There's a wheelchair basketball tournament that goes on that has participants that are wheelchair users and non-wheelchair users, but of course everyone uses a wheelchair for the tournament. This is also just to kind of demonstrate, we do a lot of adaptive sports coverage. We do wheelchair basketball, wheelchair rugby, wheelchair tennis, sled hockey. We have a ton of exposure to adaptive sports. And yeah, I guess we'll kind of keep it moving.
And also non-adaptive sports, but
yeah.
We just threw this picture in because face cake is really fun. When you start at NRH, they do a whole ceremony, and then Jennifer makes sure she cuts out your face, so you get to have a piece of cake with your face on it.
So this is just a call schedule. We don't have to go through all the details on this, but basically as a PGY2, you take the majority of the call. As a PGY3, you take a little bit less. As a PGY4, you take a little bit less. So basically your call schedule gets better as you keep going. I don't think this is super different than what other programs are doing, but we do in-house call, which means that after you do a call, you do have a post-call day the next day. Some people like that more. If you're someone that prefers at-home call, then this would probably be something that would be not something that you're really looking forward to. And
just one thing to calm people down, even though we are a freestanding rehab hospital, we're connected by a bridge to Washington Hospital Center, where you'll all, if you end up coming, we'll do your intern here. So it gives you kind of you have access to a CT scanner overnight, and you don't have to just send them to the emergency room or call 911 to get that help. And then just to throw in the current salary, DC can be seen as an expensive city, but you're pretty well compensated. This is with the increase in salary from here, from this year. And then just more benefits.
Yeah, more benefits. We get a lot of textbooks every year. As you can see, we get 20 days of vacation, which can be used kind of, you don't have to book them a year in advance. You can kind of go like up to like 6 weeks technically, as long as you let your attendings know, and you can take them off 1 or 2 days at a time. You get 5 days of sick leave, and then you get administrative leave as a PGY4 for like interviews or for jobs or fellowships. An educational fund that's $833 a year that rolls over, so you can get more, you know, if you don't use it all your first or second year, you can continue to use it. Conferences, like we said, if you're presenting even a poster, they will pay for everything for you to go. And then you can get all house staff at MedStar have access to a $1,000 emergency loan.
And then here's our information if you have any questions, and our Instagram and Twitter.
Yeah, follow us.
And let me see if I can figure out how to get back to the question thing on here. There we go.
There it is. Oh, there's so many questions.
Not necessarily, just chats. Let's see.
Okay.
So Dr. Wisataky answered some questions on the chat, but there's a few more there you guys can go over. So I'll let you guys.
Oh, there we go.
And just so everybody knows, I'm pretty much we're using my computer that I use my educational fund to buy. So it's a very good.
They only apply in the PGY3 and PGY4 year.
He answered that. Wisataky answered that one. Thank you, Dr. Wisataky.
I know, he did so many things. Cost of living in DC is expensive, yeah.
So yes, so cost of living in DC is expensive, and it also depends on where you're coming from. I came from Boston, grew up in New York, or went to med school in Boston, grew up in New York, and for me, cost of living here is not too bad. I'm actually able to. We're sitting on the balcony of my apartment right now, which is pretty nice.
So there's some questions about the experiences at Walter Reed and Children's National. So Walter Reed National Medical Center, we go there and do our EMG training. So you do 3 months as a PGY3 and a month as a PGY4. Walter Reed is a really unique training center because they don't really operate in the same way that non-military healthcare is, that non-DoD
because it's very different than the VA.
It's actually a really amazing experience, and everyone pretty much loves it. The physicians there are really great. They're super smart, and they're not pressed by the same time crunch that you get in the civilian world. So they take a lot of time to have more time in care. And that's where you get a lot of really interesting cases, because there's a lot of injuries and exposures that happen to people who are deployed military that you don't really see in the civilian world. For children's, we do 1 month of inpatient peds, which, like I said, is their inpatient unit is technically at National Rehab Hospital, and then 1 month of outpatient/consults, which is done over at Children's National. Children's National is like one of the best children's hospitals in the country, so you see a lot of zebras there.
I think it's #1 NICU, #5 Children's Hospital.
Yeah, it's really great.
At least that's what the banner says.
Also, you can we actually have someone right now using an elective to go back to Children's. You can use as much elective time as you want, really, if you wanted to expand your experience to have more peds.
Let me see if there's anything else we missed.
That is it. I think
Sorry?
you guys got it. I think you guys covered